Hello there, this is Dr. Thomas Johnson from Chiro Plus in New Orleans. Today I'd like to talk a little bit about chiropractic and headaches and different kinds of headaches, kind of the treatment that goes with that, things you can do if you're suffering from headaches. You know, headaches are a little mysterious, even though they affect, many, many millions of people a year worldwide. We don't really know a lot about them. They're not really fully understood. And the changes that occur in the function of the blood system and the nervous systems on specific areas in the brain kind of causes chemical imbalances within the body. And that ultimately leads to migraine headaches and attacks. So it's interesting that, to me, that chiropractic treatment has been shown to be effective in migraine cases, different forms of cluster headaches, post-traumatic headaches. Anecdotally, in my career in the last 25 plus years, we've worked on many hundreds of cases of chiropractic therapy for headaches. And I know anecdotally we're very successful at treating majority of the headaches here at the clinic. They're not normally, I guess we divide them into the headaches into two subdivisions. In my mind, there's just the common headache and then there's the classic migraine. Usually headache pain is, normally covers half of the forehead or maybe one eye, also spread to the back of the head. Sometimes it's located over both eyes. The sensations that people describe in patients are including throbbing, pulsing, stabbing pains. We're breaking this down into number one type of a common migraine. This is the most common headache that accounts for at least 85% to 80% of the attacks that we see. And research indicates that there's a change in the cerebral blood flow, which is responsible for the symptoms. And that's just an occurrence that happens organically up in the brain. And a typical pattern for it's usually on one side, it's pulsing. They start younger in your adulthood. They're more common slightly in females. They interfere with your daily activities oftentimes. And this is the one that I see that really has a lot of nausea and vomiting with it. The classic migraine, even though it's called classic, you'd think it'd be the biggest one that we'd see, is really only about 10 to 15% of the attacks that we see. And it's a typical throbbing pattern. It's on one side of the head also. It's usually preceded by what's called a prodrome, which just means a quickening of the sensations or a foreshadowing that you can sense that something's getting ready to onset. There's a throbbing, and usually you'll see visual flashing lights. You'll have a presence of a blind spot, and usually these last up for 30 to 45 minutes, somewhere like that. And then that's replaced with just a disabling headache that can last for many hours, 3 to 5 hours. You don't have to usually have vomiting with that or nausea. It's a little bit different in regards to that. Some of the patterns that cause this are what we call triggers. The triggers related to the onset are pretty common. You've heard of some of these, I'm sure. We know about stress, and that's common over the holidays. And foods, chocolate, the caffeines, nitrates, cheeses, nuts, and wine. If you give me a call, we can list many more. There's a lot to talk about with this. I'm just trying to give you a baseline for understanding on this. Changes in the sleeping habit. Sometimes the menstrual cycle can cause that. Tension in the neck, we know that that's really common. Also, treating the headaches is very important. So we need to identify these triggers and manage the problem really is in behaviorally within lifestyle changes and what causes the headache to start or to trigger and to go that direction. Some of the things that we use here as far as treatment are nutritional and herbal supports. A lot of times some of the omega-3 fatty acids are good, magnesium classic, calcium classic, vitamin D, I think one of the most exciting areas right now, vitamin D therapy is very good. We also look at acupuncture. We use that here at the clinic often and refer it to other practitioners. We know about chiropractic, and the treatment in that has been proven in many trial studies is very, 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 very effective. Excuse me. So the treatment's really important. And I guess here at the clinic, when we audited this, over 50% of the people were getting an average of about 3 treatments, 3 to 4 treatments over a 2-week period. And that was basically, we could get 50% of the people there, 50% improvement. So that was really good. If you've been suffering from a recurring problem or have certain indications that put you at risk, you may want to come by, give us a call first, or come by. We can set up an examination or answer questions on the phone. There's a free consultation where you can sit down and talk as long as you want about how your overall for you, to see what would work best. So I'm just going to close now, and with my thought of the day is that chiropractic is so often the answer, and just reflect upon that. I'm Dr. Thomas Johnson at Chiro Plus. Appreciate you very much.